One of the criteria for meaningful use is the ability to provide a clinical summary to 50% of the patients during the monitoring period. A clinical summary must be provided within 3 business days to meet meaningful use. The clinical summary can be printed out by choosing the icon under the CS tab. It is recommended that before you begin to enter information into the clinical note, that you update and edit the patient's problem list. An updated problem list is part of the meaningful use requirement for the clinical summary. The problem list can be accessed by choosing Problem from the tab set. This will then bring into view the problem list along with the past medical, past surgical, family, and social history. Single items can be edited by choosing right-click function over that item. In this case, we have chosen acute venous thrombosis. A table of contents has been brought into view for you to perform the selected editing process. In this case, we are going to resolve the problem acute venous thrombosis. Resolve will remove it from the active list and move it to the past medical history. For items that are not being actively managed by a physician, but still need to be visible as part of the past medical history, this is the desired action. For items that have been resolved and are no longer a significant portion of the medical history, you can choose right-click function over that item, and in this case we will resolve and suppress mammogram screening, and as you can see it will remove it from the active problem list and place it into the suppressed category. If you desire to see previous entered in error or suppressed items, you can choose the Show Hide icon at the bottom of the screen, and this will bring into view suppressed problems and prior problems entered in error. To manage multiple items, you can choose the Control button and then with left-click function highlight the selected items. In this case, diabetes, hypertension, and pharyngeal disorder have multiple entries. You then can choose right-click function and change status to entered in error, or you can choose the enter in error at the bottom of the screen. This will then remove these items from the problem list. For problems that are going to be assessed during today's visit, you can then select these items from the problem list, and then returning to note, these items will then be visualized under the assessment portion, already checked to be assessed, and then will allow you to move into the documentation of the note. Requirements for the clinical summary for meaningful use require entering data for the reason for the visit or chief complaint, the updated problem list, the updated current medication list and allergies, immunizations that were administered during the encounter, any procedure that was performed during the encounter, the assessment of the problems for that visit, the plan which would include any imaging, laboratory, or medications ordered appropriate for the assessed problems, and the discussion summary. This would include any narrative regarding follow-up visits consultations or information instructions to the patient. The IT department has created a tab, Reason for Visit. This can be edited for individual departments so that this will be visible on each established and new patient note, and then would allow you to choose the information with a single click, and would allow this information then to be completed, as you can see in the note accumulator at the bottom. The active problem list was recently managed before we began working with the note. The assessment, if the problems weren't assessed through the problem list, can now be assessed. This is an important aspect of the quick sets. This can be chosen from the open book icon with the plus on the toolbar. As you can see, the two problems, diabetes and hypertension, that were assessed under the Q sets of problem-based orders. The default is send to retail, and then you can choose a prior medication that was ordered attached to that ICD-9 diagnosis. This would then forward this information once you have selected OK. If you would like to edit the information, you can use the right-click function, Edit, and this will take you to the prescription tab. As you can see in the top right-hand corner, the diagnosis is linked to hypertension. You can then make the medication changes that you desire. You can also order lab and imaging based on prior diagnoses that you had utilized. Under Plan, you can also choose New, which would then take you to the second tab, Prescription Orders, and then choosing from one of the tabs, order the appropriate prescriptions, imaging, or laboratory. The follow-up referral is an option for those that are not using self-documentation, and that would allow you to choose one of the predefined visits. Also, patient instructions are available that can be utilized to add to the clinical note without using the free text information through typing or dictation. These are of some value for those that are still using transcription services that would allow you to complete the note at the time of the encounter. To see all the options, you can select the search box, then using the percentage symbol 3 times, and then enter will allow you to search all the options that are associated with the Allscripts program for instructions available. To visualize and remove the columns, you can choose the column tab, and this will then allow you to see the full description. Information that was covered or considered during the visit and future appointments can be entered through the Discussion tab in the table of contents. 3 text boxes have been created. One allows free texting all the information in one text box. You can choose the discussion that would allow you to separate diagnosis and information attached directly to that diagnosis. You can choose Summary that would allow you to enter further information regarding the encounter. This is particularly helpful if you are coding by time, and then allowing you to choose a follow-up time, which will then allow this information to be entered into the note without using a free text format or transcription services. Right-clicking over discussion summary would allow you to view a table of contents that would allow you to add pre-designated forms created by Allscripts. In this case, we'll choose Add Form Top, and it will bring in a form selector. This will automatically default to your specialty, and because we chose discussion summary, this will list all of the forms that have been attached to the discussion summary. If you desire to search the index, you can choose several keywords attached to the diagnosis, then choosing the binoculars. This will allow you to narrow your search. If you want to search the entire dictionary, you would choose Filter by Specialty, and this would bring in this case, all of the discussion summary forms that begin with ABD. By choosing the percentage sign with the default as Filter by Specialty and then choosing the binoculars, this will allow you to view all of the discussion summary forms that are available. These can be loaded by the IT department based on specialty. If searching any of these forms, you would like to add them to your default specialty under Form Selector, please let Ann Prince know, and she can transfer this information from the general dictionary to your specialty specific dictionary. To print the clinical summary, the information once committed, you can choose Provide Clinical Summary in the bottom left-hand corner. Then you can choose Save and Continue. This will bring the print dialog box into view. You can then choose the Print Clinical Summary if that is not your default. You can then check Save as default, and this will always allow you to move directly to the clinical summary when you choose the clinical summary print. You can then preview, and the information that is required for meaningful use will be visualized. And then the clinical summary can be printed to the designated printer.